All right. Uh, Good morning. If you're listening to this in the morning, I'm Dr. James Christ. I'm a licensed clinical psychologist and a certified substance abuse counselor. Welcome to this webinar for Circle of Support on Anxiety in Children, Parenting Strategies for Success. I've been at give you a little background about myself. I've been at the Child Family Counseling Center for about 30 years now. I work with kids of all ages, young children, as young as 3 or 4, all the way on to senior citizens. So I see a range of people. I also work with people with addiction issues as well. So I do psychological testing and I do family therapy. And Child Family Counseling Center has been around in actually longer than that. Dr. Renee Burdette is our medical director. So we have at our office, we have a range of services we can provide, from psychiatric medication through psychological testing and of course counseling. All right, so let me give you a little introduction to the talk today. Worries and fears are common in children. It's developmentally normal, meaning that when you see younger kids having a fear of the dark or whatnot, it's not something to worry about. It's most kids will grow out of them as they get older and as their cognitive abilities improve. That's why it gets better as kids mature. For some kids, however, symptoms can be severe and cause major problems in functioning. They may have trouble going to school, they have trouble going to bed at night, they can't sleep alone. They may be afraid to socialize with other kids. And so if left undiagnosed and treated, it can lead to the development of anxiety disorders, especially as they get older. And anxiety disorders tend to prevail through adulthood. So potential consequences of untreated anxiety include repeated school absences. If you have kids who are too afraid to go to school, they're going to miss out on learning, they're going to miss out on social activities. Moving ahead to high school years, they're more likely to drop out of school because they can't handle the anxiety of being there, whether it's the academic rigor or problems getting along with peers or just being away from parents, a separation anxiety. So obviously this can lead to impaired peer relations. If you're not able to interact with other kids your age, you're not going to develop the social skills that you need for success in life. Low self-esteem will occur. If you're a kid who can't join a sports team, for example, because you're too afraid to try out, you're not going to feel very good about yourself. If your grades are low because you're not attending school, you're not going to feel very good about yourself. One of the things to be very concerned about here is that as a potential consequence of anxiety is addictive behaviors to self-medicate, including technology. For a lot of anxious kids, when they're online playing games or whatnot, their anxiety is much less because the interactions are different. And so if you are that anxious interacting with others, you get holed up in your room. And again, there's a lot of things that you miss out on. Certainly a higher risk of alcohol and drug use. Alcohol and marijuana both work pretty well at reducing anxiety for some people. And if kids find this out early on, the chances of addiction as they get older are much higher. Workplace problems. The difficulty even just applying for a job could be overwhelming for a lot of kids with anxiety. And finally, as I mentioned earlier, the risk for anxiety disorders in adulthood is also greater. So let me give you an outline of what I'm going to talk about today. We're going to talk a little bit about the prevalence of anxiety, how frequent it is, some of the common fears. We'll talk about the causes of anxiety, the fight, flight, or freeze mechanism, some of the symptoms of anxiety disorders. We'll talk about some of the causes there. For example, it's genetic, it tends to run in families. What we do in terms of diagnosing anxiety disorders. Some of the parental factors in children's anxiety. I'll talk a little bit about what you may be doing inadvertently that could be contributing to your child's anxiety. We'll talk about teaching coping strategies to kids. We'll spend a good amount of time doing that. And then I'll talk about when professional help is needed, whether it be counseling, medication, things of that nature. All right. So let me start here. Again, common childhood fears, they are normal, definitely normal in kids. For preschoolers, under age 5 or so, common fears include separation from parents, getting lost is pretty scary for kids. You go to the mall and they're afraid to get lost, and so they cling to you. The dark, and it's not just the dark, it's what might be lurking in the dark. Sleeping alone is very difficult for some kids, especially if there's like bad weather or bad things happening in the family. could be a death in the family, you're going to see maybe more separation anxiety. Monsters and zombies, kids at a young age don't realize that they're not real. So if they look real, they're going to be afraid of them. Bad weather is a common fear, loud noises, people in costumes, clowns, because you don't know, you can't read their faces, so you don't know whether or not they're friendly or not. Moving on to elementary school, fear of failure, certainly there. If you're somebody who has some academic challenges, say you have ADHD, for example, it makes it harder to stay focused, or you may have a learning disorder, that fear of just failing and then having to go home and deal with parents and their reactions to bad grades. Peer rejection, obviously getting along with peers and being accepted is important. Worrying about teasing, bullying, middle schoolers as well. A lot of kids don't know how to deal with teasing. A lot of times adults will tell them, oh, just ignore it, which is not so easy as a kid, especially if you're an anxious kid. Being separated from parents, death. Kids are starting to understand death, and that's a pretty scary thought. Doctors, shots also. Moving on to middle schoolers, again, some of the same fears there, but also you're looking at peer rejection. If you are sort of on the outs with the other kids, you're not part of the in crowd. Health, grades could also be more of a concern in middle school. Finally, moving on to high schoolers, they worry more about the future, adulthood. Becoming an adult, especially in today's society, is pretty scary for a lot of kids. Of course, gone are the days where you could earn a living on minimum wage. I don't know if that was ever really true, but self-image, again, how other people perceive you, worries about careers, what am I going to do? Opening up to parents. So let me say something about that. As parents, you probably want your high schoolers or your kids in general just to open up to you. But if your reaction is not very positive, they're going to hesitate telling you. They go to a party, for example, and bad things are happening, and they tell you, and then you say, well, okay, you're not going to go to parties anymore. Then you're punishing them for being honest. So that's a very tricky thing for parenting, and there's not really a right or wrong answer. But be aware that if you're not an approachable parent, your kids are going to be less likely to come to you when they really need to. All right, so when to be concerned? When worries and fears and anxiety in general, when it becomes excessive for a child's age and circumstances and persists beyond what is normal for the age. Okay, a 4-year-old being afraid of sleeping alone is different from a 10 or a 12-year-old being afraid of sleeping alone. When it causes problems in functioning, okay. For example, think of anxiety, shyness. Some kids are afraid to go up to people, but once they do it, they're fine. You just have to maybe give them a little bit of a push. We don't worry about that so much. It's when they can't do those things and they're missing out on activities as a result, leading to it's a source of distress for the child. If your child is feeling bad because of the effects of the anxiety, that's a time to be concerned. It's a source of distress for the family. If you have somebody with a child with separation anxiety who is so afraid to go to school that you are late for work constantly or having to take off work to go pick up your child because they're melting down at school, that's a time where help is needed. And again, untreated, it can cause trouble with focus, learning, and health. So it's very important if you see signs of anxiety to have an evaluation if you're seeing some of these other issues occurring. Okay, this little poster here is what anxiety feels and looks like. And I put this in here just because there's so many different ways in which anxiety can be manifested. Okay. You know, you could have tight chest, restlessness, tenseness, headaches. A lot of times headaches and stomach aches are signs of anxiety. Look at the bottom here. What if? What if this happens? What if that happens? We call them, again, the what ifs. Kids can drive themselves crazy just thinking about all the different possible bad things that can happen. You may have stomach aches, as I mentioned, loss of appetite, difficulty with sleep, wanting constant reassurance. One of the things you have to be careful of as parents is that kids often want your reassurance, but if you overdo it, then they become reliant on your reassurance. Kids with obsessive compulsive disorder, for example, we may ask you, tons of questions, the same questions over and over again. And that can be very frustrating for parents. And you have to be careful not to keep answering the same questions over and over again. One of the things we sometimes do with kids with OCD is limit them to a certain number of questions they can ask each hour. So they have to pick and choose, which helps them get a little bit more control over it. Mind reading is one of the things up here. And what I mean by that is that kids with anxiety sometimes will read negative intent into other people's actions. So that's kind of mind reading. You think that somebody's intentions towards you are negative when they're not at all. But when you have anxiety, you assume that other people are somehow threatening in some way. Same with a fear of like animals or pets. Kids with anxiety may assume that a pet is going to be aggressive towards them, even if there's no evidence to that. All right. So let me talk a little bit about the frequency of anxiety disorders. Research shows that about 13 of every 100 kids or teens have anxiety disorders at some point during their development. Okay, up to 32% of teenagers have anxiety disorders. They are more common in girls. Some of the studies indicate that there may be a 2-to-1 ratio, twice as many girls as boys having anxiety disorders. 50% of kids with an anxiety disorder have a co-occurring disorder. And what that means is that you have a disorder that occurs along with another one. And this can complicate treatment. For example, if you have somebody with ADHD and anxiety, they're co-occurring, you have to take into account the other disorder when you're treating the anxiety. For example, if you have ADHD and you're on a stimulant medicine, and you also have anxiety, stimulants can sometimes make anxiety worse. So that's important to be aware of. Again, keeping in mind that if you have more than one disorder going on, it's really important to treat both because they can work across purposes. One of the difficult things we have in terms of just diagnosing something like anxiety or ADHD is if you look at the symptom of inattention, trouble staying focused, that can occur with ADHD, that can occur with anxiety, and that can occur with depression. So it's really, and that's why it's important often to have a professional evaluation to find out which of those things it is. Because if you treat it as anxiety and it's actually ADHD, that can cause problems in terms of treatment. So the lifetime risk of anxiety disorder is about 25% of the population. It's one of the most common disorders that are diagnosed. The lifetime risk of social anxiety, just to give you one example, is about 17%. And social anxiety, we'll talk a little bit more about that later. Interestingly, only about 9% of the kids with these disorders try to take some sort of action to counteract the anxiety or to try to treat it themselves. And 25% of it keep it to themselves. So they may not even tell you what's going on with them. Sometimes they don't have the words to even describe it to you, so that can make it harder for them to talk to you about it. All right, let me talk a little bit about the origins of anxiety. And I'm going to start with the definition. Definition of anxiety is a subjective sense of worry, apprehension, fear, and distress. Okay? And it is a survival mechanism to keep us alive through the fight, flight, or freeze response. Okay? So let me explain how this works. One second. Yeah, I'm going to go to this one real quick here. This is a view of the brain. And so pay attention to the prefrontal cortex here, and then the amygdala, which is a gland in the brain. Okay, because I'm going to talk about those. So when the body perceives some sort of danger, your brain will activate the fight, flight, or freeze response. The amygdala part of the brain will trigger that response. We call that their fear switch. And what it does is it switches on very quickly if your brain detects a potential threat. It's a survival mechanism to keep us alive, which is one of the reasons it is such a strong response. Because if you think of, days back in, caveman days or whatever, you don't have time to think if you're under a threat. You got to act quickly. And so it goes on very quickly, and that can be very overwhelming. Again, it's evolutionarily adaptive. If we didn't have this fight, flight, or freeze response, we might not have survived as a species. We have two different nervous systems basically in the body. The sympathetic nervous system is what activates the fight, flight, or freeze response. Once the danger is past or perceived to have passed, then we have the parasympathetic nervous system that deactivates the fight, flight, or freeze response and returns back to normal. Okay. Let me just say a little bit more here about the fight, flight, or freeze. Fight, flight, or freeze refers to 3 different ways the body has to try to stay alive. If you are being chased by a saber-toothed tiger, for example, you try to fight the tiger. That could be one way of surviving. Flight means you run as fast as you can, climb up a tree or whatever, or you can freeze. And freeze is when you stay very quiet. So you try to hide from the source and hoping that the danger passes. I like to think of the freeze response as being similar to kids hiding it, behind their parents, or you have to drag them out of the house to get them to go to school. And I'm not saying that's a good strategy, but they're hiding. And one of the reasons they react so strongly is there's a part of their brain that thinks that something really bad is going to happen, which actually the freeze could turn into flight and fight very quickly with kids, because kids with anxiety disorders, especially separation anxiety, can have a great deal of adrenaline pumping through their system, and the temper tantrums they can throw when they're that anxious can be very severe. One of the things as parents you need to keep in mind, though, is your child's body is trying to keep it safe. So you may see the meltdown as somehow disrespectful, but that's not it at all. They're terrified. And so you have to make sure that your response takes into account just the sheer level of terror that your child is feeling in that moment. Energy conservation system, let me just mention that real quick. Basically, the fight-flighter system, when the adrenaline is pumping in your body, it really wears you out. And you don't want to have that be on constant state of alert. So that's why it's designed to kick on quickly, because that allows the body to relax most of the time, conserve energy, which again keeps you healthier. One of the problems we have is if you are chronically anxious, that fight, flight, or freeze response is active all the time. You got adrenaline going through your body. You've got cortisol, which is one of the other hormones that goes through your body when you're anxious. And those things wear the body down, can cause damage long term. So another reason why it's important to get anxiety under control, because it can affect your health, as you get older. Let me say a little bit more about this. One of the things that happens is during the fight, flight, or freeze response, the amygdala shuts off the prefrontal cortex, because that's the part of your body or the part of your brain that thinks and analyzes and processes information. So why does that happen? And there's a term for it, neural hijacking. So if you are being threatened physically and you stop to think about analyzing the situation and figuring out what to do and weighing the pros and cons, you're going to be dead. So when you're in acute danger, thinking and processing and analyzing isn't very adaptive. So that thinking part shuts off. It's one of the reasons why it's so hard now to help kids get a better handle on anxiety, because when the thinking shuts off, it's pure emotion. So one of the strategies we use in trying to help kids with anxiety is to keep that prefrontal cortex, the thinking part of your brain, active, because that part of your brain can tamp down the amygdala, especially over time, that you can learn to use, for example, relaxation exercises, deep breathing, reminding yourself that this is not a dangerous situation, that you'll be okay, that positive self-talk. All those things are ways of keeping the thinking part of the brain going, so it can tamp down. Because if you wait too long, once the amygdala kicks into place, the thinking stops because it's not adaptive. Thinking in that moment doesn't keep you alive. Unfortunately, most of today's sources of anxiety are not physical fears to your life, but your brain reacts the same way as if it were. Let me talk just real quickly here. One of the things we do, or one of the things the researchers are doing in terms of trying to understand brain functioning more, is they do these brain scans. And so at the top, you see a sign of the normal brain. Excuse me. And a normal brain means the activity is pretty normal. When you have anxiety, for example, you have elevated activity in certain parts of the brain. And so when those parts get activated and there's excessive activity, it's harder to shut that down. So one of the things we try to do in treating anxiety is you want to tamp those areas down so that they don't get activated. And if you can keep them from getting activated, then again, you can use your thinking to try to get things under better control. Okay, let me talk a little bit about the experience of anxiety. Sometimes it's helpful to sort of break it down into 3 different components, okay? So you've got the physical sensations that happen to you, and that's like breathing, deep breathing or breathing too quickly. You got your heart beating fast, you're sweating, your extremities may get cold. because all of your blood is going to your muscles to try to get you to prepare you to fight or run away. So we've got emotional reactions, and that's the kind of experience of fear, worry, dread. So the emotions that are happening as you are experiencing these sensations. And you also have thoughts and beliefs that are part of anxiety, okay? That's the what ifs. What if this happens? What if that happens? You know, this is not going to work out. I'm never going to be able to do this. Something bad's going to happen if I leave home, if I'm at school. So one of the things we do with treatment is we try to focus on thoughts and beliefs as much as we can, which can be easier to address. For example, a cute puppy. Let's say you have two kids walking down the street, and there's a person walking towards them with a dog on a leash. One child may look at the puppy and think, oh, this is a cute puppy. Oh, come here, puppy, and get down and want to try to pet the puppy. This child believes that dogs are friendly. And so that child is not going to have an anxious reaction because that's not the belief or expectation. Another child, though, when seeing a cute puppy, may think something very different. They'll say, oh my God, it's a puppy, the dog, it's gonna run after me, it's gonna bite me. If you have those thoughts or beliefs, you're gonna be anxious, and your body's gonna kick in with the fear, the worry, the breathing's gonna get fast, and some kids even have a panic attack. You know, they're so afraid. So now it's possible that this second child may have had a bad experience with a dog in the past. So that might be understandable, that the thought or belief or expectation is that dogs are harmful. So one of the things that we do with kids is we try to help them change their thinking, help them recognize when a dog may be friendly or afraid or scared or whatnot. May tell them what to do in a situation if there's a problem. So, so when you can change those thoughts and beliefs, then the anxiety goes down. If you can change your thoughts and beliefs about yourself, if you say to yourself, people like me, so if I go to school, I may be a little shy at first, but usually people like being my friends, so I don't need to be so afraid. If your thought is nobody likes me, I'm going to get teased, you know, all the kids pick on me, again, your anxiety is going to be higher. So hopefully that makes some sense. Exercise, relaxation are two actually very different things, but both can help with the physical effects of anxiety. Okay, so exercise helps because exercise mimics the fight or flight or freeze response, running, fighting, those sorts of things. So it's almost like when your body gets exercise and then you stop and your body comes down through the parasympathetic nervous system, your brain basically thinks, oh, the danger must have passed. We've already fought the animal. And so then again, it calms you down. So exercise can be helpful for anxiety. It can also be helpful as a preventative. People who get more exercise tend to have fewer problems with anxiety. Relaxation is sort of the opposite thing you can do. That's a way of sort of inducing the parasympathetic nervous system on your own. When you do deep breathing, meditation, mindfulness, noticing things in your environment, things like that, that helps calm your body down as well to try to, again, deactivate that fight, flight, or freeze response. All right. Okay, let me go next into some of the anxiety disorders. Okay, I'm just going to say something briefly about each anxiety disorder. So generalized anxiety disorder, these are kids with this disorder. They engage in extreme, sort of unrealistic worry about multiple everyday activities. They're going to worry excessively about their grades, about sports, about their performance on the team, about being on time, even finances. I've had kids with anxiety coming in and say, oh, mom, you got to pay a copay to come in here? You know, we can't afford that. That's too much. They worry about things that they shouldn't have to be worrying about. They may even worry about, you know, college at that point. You know, these are kids who are very self-conscious. And so when you have generalized anxiety disorder, that fight or flight system is activated much of the time, which again causes stomach aches, headaches, things like that. So one of the things we do in treatment, for example, is we try to help kids tune into those symptoms. Hey, you're having a stomach ache right now. What might you be anxious about? And sometimes kids aren't even aware of it, but you point it out and they say, oh, this is a signal that I'm anxious about something. And once they recognize the signal, then they can do something about it. All right. Separation anxiety disorder, that is as it sounds. These are kids who are anxious and afraid of being separated from their parents, okay? So these are kids who would not be able to have a sleepover at a friend's house, most likely, because their anxiety builds. These are kids who may fight going to school, you know, for kids with separation anxiety, the first day of school, the first day after, the winter break, those are difficult times for kids. The day that they, try out for a sport or whatnot. Again, and they're afraid of being separated from you because they see you as their safety person that's to keep them safe. But one of the factors in separation anxiety is that kids are afraid of being separated from you because they think something bad's going to happen to you while you're separated that's going to keep you from ever coming home. So let's say you and your spouse want to go out to dinner. Your child has a really hard time with that. Maybe the babysitter's there, but they still don't feel safe because they worry that you're not going to come back. These are kids who will call you repeatedly on your cell phone. Where are you? Where are you? When are you going to come home? So one of the things we do for separation anxiety disorder is help kids sort of desensitize to it. So maybe parents would go out for a brief period of time and come back and do that repeatedly to sort of desensitize the kids to you being gone for short periods of time. Sometimes distraction works. The babysitter's playing something fun with them. Sometimes giving them allowing them to check in with you maybe once an hour, where you'll accept a call from them and just say, okay, we're doing okay. Sometimes, speaking of desensitization as well, one of the interventions I often recommend for kids with anxiety about going to school, which again involves separating from you, is to do it repeatedly in a way that's kind of funny. So, so what you might do is maybe a week before school starts, get dressed, go to the school, pretend to drop your child off. Child goes to the front door, says, "Hey, have a good day, love you, bye." And then you drive around the block or whatever, and then come right back, or drive around the parking lot. So obviously you're still seeing your child. And then you can do that like 5 or 10 times. By the 10th time, it seems really silly. And that's actually part of it as well, if you're kind of laughing, so that when you actually have to go to school, your brain knows, oh, I've already done this and nothing bad has happened. So that something like that can help you desensitize to that separation anxiety. Similar treatment can actually work with specific phobias. Specific phobias are unrealistic and excessive fears of situations or objects, usually centered on animals, storms, weather, heights, situations like being in an enclosed space, spiders, things of that nature. So again, one of the things we do for specific phobias is desensitization. For example, you may have a child who's afraid to be around a pet, but you just stay there with them and you wait it out, you do some deep breathing, and gradually your child may approach the dog. You might take that 10, 20 minutes, whatever. But what you're doing is the longer you're there and you realize, hey, nothing bad's happening. And if you repeat that experience, you can sort of break that connection between dogs being threatening and you being afraid. So you gradually expose yourself to it a little bit at a time. Social anxiety disorder, sometimes also called social phobia. These are kids who get anxious in social situations, okay? Their fear has to do with being criticized, judged, teased, etc. Being embarrassed or humiliated in front of other kids. Think class presentation. That can be very anxiety provoking because they're afraid of being laughed at. So again, kids with social anxiety disorder are going to have a very hard time interacting with peers. Sometimes they do better with adults than they do with peers. But again, they're afraid, they don't want to go to recess because they're expected to play with other kids. These are kids who will cry, freeze, they'll cling as well. So it kind of looks like separation anxiety in that respect. But again, the social anxiety has to do with the fear of new people. Usually once a kid with social anxiety feels safe with somebody like a friend, then they're okay and they won't have that same fear with that particular person. The same with family. They're not going to be afraid generally of family members because they're used to you and they see you as being safe. So there's a lot of avoidance that goes on in social anxiety. Again, avoiding these social situations. You can see if you look at all the activities that kids would not be able to do because of it. Joining a club, joining a team, even being part of like a scouts, for example. Interviewing for a job is going to be terrifying. Say you do get the job as a later teen, having to interact with coworkers or the public in general can cause a great deal of anxiety. So obviously this can greatly restrict somebody's life. Again, desensitization is one of the strategies that's used there as well. There's a group in Washington, D.C. specific to social anxiety. And I've had a patient who's gone through that, and they will do things like having people go out in the real world and do things like sit next to a stranger or ask to borrow money from a stranger and just see what happens. And then what happens if they do that? Then they debrief and say, hey, I have social anxiety. I'm just practicing, because obviously people are going to kind of look at you weird if you just sit down with them and ask for money or whatnot. But again, the idea is you put yourself in those situations and gradually you desensitize. Panic disorder, these are people who have a panic attack. Panic attack just feels like you're going crazy. Your heart's beating fast, your stomach is hurting, your muscles may get tight, you may feel dizzy, and there's not necessarily a identifiable trigger, and that's what makes panic disorder so troubling, is because it could happen, on the metro going to work, or in your car, or in the middle of a theater. All of a sudden, you just have this panic attack, and again, you feel you're going crazy. Sometimes people feel like they're having a heart attack, and with kids, obviously, that's highly unlikely. The panic attack may only last 10-15 minutes, but it really feels like an eternity. So one of the things we do with panic disorder is that when it happens, for kids, learn to identify it. Okay, this is a panic attack. I know it's not going to kill me. Let me take some deep breaths. Let me relax. Just let it wash over you, as opposed to trying to fight it. Because sometimes when you fight a panic attack, it just makes it worse. You just have to let it, go through. Sometimes grounding yourself when you're having something like that happen. Whether it's a stuffed animal, a pet, even a crystal or a rock, something that provides some comfort can help with some kids to be able to sort of ratchet that down a little bit. One of the problems with panic disorder that makes it sort of transitions it from just a single panic attack to panic disorder is there's a fear of having another panic attack. So you're afraid to go into situations because of that fear. So that avoidance is what causes the impairment in functioning. Agoraphobia is just a fear of leaving the home. That can sometimes go along with panic disorder, whereas you're afraid to leave home because you think something bad's going to happen, or you think you're going to have a panic attack, for example. Obsessive compulsive disorder, called OCD. People with OCD they get trapped in a pattern of repetitive thoughts and behaviors, okay? You could have obsessions, compulsions, or both. Obsessions are like ruminative thoughts, like repetitive thoughts. Remember we talked about the what if? Compulsions are behaviors that you engage in, and they tend to go together. For example, you can have somebody with an obsession. They're obsessed about their hands being dirty and getting germs. Obviously, this was worse during the worst of COVID. So the repetitive thought is, I touched something, maybe I have germs, maybe I can get COVID, maybe I'm going to get sick, maybe I'm going to get the flu. And so you can't stop those thoughts until you wash your hands. But washing your hands isn't just the 20 seconds doing it to the happy birthday song, as we tell parents that's about as much time as you need to wash your hands. They may do it for 5 minutes, 10 minutes, and they do it to such an extent and so frequently that their hands start getting raw. You may have some bruising on that, and it actually can break the skin, which ironically makes it more likely that you might get an infection. So that's one of the things we try to tell kids as well. Other compulsive behaviors involve like arranging things in order a certain way, having to do things a certain number of times. So like there's counting things where you have to count things. This can cause problems in school because you have kids who have OCD symptoms related to, say, writing or taking notes. The letters have to be formed perfectly or a certain way. If you don't do it, then you have to go back and start all over again. And that's not going to allow you to be able to, for example, take notes. Other obsessive thoughts have to do with, again, the what ifs. Is this okay? So some kids that have OCD related to food, is this food okay to eat? Is it expired? Where did you get it? It looks a little funny. Maybe it's going to make me sick. So, and this can be very debilitating. Technically, to diagnose OCD, it has to be present for an hour or more a day and cause impairment in functioning. And for some kids, that's low. Post-traumatic stress disorder, PTSD, these are symptoms that happen post or after a traumatic event occurs. And the trauma could be something that happened to you or something that you witnessed. So kids actually can get PTSD from seeing scary movies, scary things on TV and the internet and whatnot. And so what happens is after witnessing that or being exposed to it, what happens is that things that remind you of that trauma then trigger a whole series of anxious responses. Again, it could be a panic attack when that happens, or you feel like whatever bad thing happened is happening all over again. Give you an example. If you have a child, give you an example, a child who was on a school bus and school bus had an accident. And for quite some time after that, the student was unable to travel down that same road because it triggered thoughts of that accident. And the child was convinced that something bad was going to happen again because of what's associated with it. And so what often happens is that when you have PTSD, you try to avoid anything that reminds you of the trauma. You can have PTSD from being bullied or being in a fight at school, and you're afraid to go to school because it reminds you of what happened. Again, you're afraid that it's going to happen again. You can have PTSD related to physical abuse, sexual abuse, things like that as well. And kids often have bad dreams as part of PTSD. So it may not be as obvious during the day-to-day functioning, but it shows up in their dreams. All right, let's move on. Long-term outcome of anxiety disorders. There was an extensive study done in 2018 where they assessed a number of children over a 4-year period. What they found is that about 21% of the kids were in stable remission. Their symptoms had improved and they had not returned. 30% of them were chronically ill, meaning that whatever they did, they were still struggling with the anxiety. 48% relapsed, meaning that even after treatment, the symptoms came back. Okay. Now, youth who responded to acute treatment were more likely to be in remission. So if you respond pretty well to anxiety, that's a good sign. But anxiety disorders in kids and adults are often chronic and may require longer term or intermittent treatment. To tell you what I do in terms of therapy is that I see kids just as long as necessary. I want to give them the tools that they need and then send them out on their own. So sometimes kids will be fine for 6 months and then a new situation comes in and they're getting anxious and they come back in for a session or two, remind them of some of the strategies that they used before that were successful, and then they're okay for a while. And so that's a perfectly good way of handling, anxiety, that from time to time it will increase. And so then you address it when that happens. Okay. So let me talk next about causes of anxiety disorders. There are a number of theories about why some people are more prone to develop an anxiety disorder in response to an anxiety-provoking situation. So you can have psychological, and these are like psychodynamic behavioral explanations. And I'll just say briefly, psychodynamic has to do, if you think of Sigmund Freud, it has to do with, underlying unconscious motivations or triggers for anxiety. Okay. So maybe you have, give you an example, a very common example. If you have two parents who are not getting along, okay, and then the child starts acting up and having anxiety problems from a family systems perspective, which is actually in a way similar to a psychodynamic, but from a slightly different perspective, the child acting up can force the parents to have to work together to try to help the child. And then if the focus is on the child, it sort of may take the pressure off the parents. That is a pattern that we sometimes will see. And for that, you really have to address some of those underlying dynamics so that the kids can recover from the anxiety disorder. Behavioral just has to do with things that happen to you. Again, if you're a kid who got bitten by a dog, that's your experience, you're more likely to have anxiety disorder because of your experiences. Genetic, there's a higher incidence of anxiety disorders if you have a family history of anxiety disorders. And we're not quite sure why that happens. There may be something going on in the brain, as you can see the biological stuff, dysregulation of neurotransmitters. It may be like there's certain neurotransmitters are brain chemicals that sort of mediate functioning in the brain. So the thought is that you may have people who have lower levels of serotonin, which is one of the neurotransmitters, because some of the medications will increase the activity of serotonin in the brain. And if you get better as a result of that, the thought is that maybe that was part of the problem. research is mixed about that. There's a whole controversy about serotonin, but the basic idea is that there's something about how your brain operates. Some people may just be more naturally anxious. For example, basic temperament, shyness. There are some kids who are very outgoing and gregarious by nature. That's their basic temperament. You see it very often, very early in life. You have other kids who are temperamentally more shy, and so they're going to have a higher response, like for stranger anxiety, that they don't respond as well. And so that obviously puts you at greater risk for an anxiety disorder if that's your basic temperament. There may be medical causes of anxiety disorder. There may be thyroid that is not working properly. Asthma can cause anxiety. If you're having an asthma attack, it's going to make you pretty anxious, if you've ever had one. Sometimes medications that treat asthma can make anxiety worse. Some of the like Flovent or albuterol, things like that. For some kids, it can make them anxious. So it's a good idea to have your child screened just to make sure. The chances that there's a medical cause are very, very low, but it doesn't hurt to just check that out, especially if you're thinking of medication. It's a good idea to, like I said, get that checked out. Okay. In terms of diagnosing an anxiety disorder, I'm sort of generalizing here, that symptoms must persist over time, usually about 6 to 12 months or so, and cause impairment in functioning. So if you only have a few weeks of elevated anxiety and then it's fine, we're generally not going to diagnose an anxiety disorder. Or if you have anxiety, like you're shy and you do get nervous about things, but you push yourself and you're able to get through it, as some kids can, that's probably not going to be diagnosed as an anxiety disorder because it's not impairing functioning so much. One of the things we do, there's a fear inventory from my book, What to Do When You're Scared and Worried. And that is let me just fast forward for a sec. This is the fear and worry inventory. This is from my book, What to Do When You're Scared and Worried. I've written a number of self-help books, about 8 so far now. And with self-help books, it's really, what I like to do in those books is take some of the information we know about adults with disorders or other issues and bring it down to a child's level. So if you give inventory like this, and you can print this out for your child, you might be surprised at what kinds of fears he or she may have that you may not even know about. One of the things I find when I'm doing an intake on a child is that very often the parents don't know all of it. If you don't know the right questions to ask, and sometimes they don't want to tell you because they don't want you to worry. So this is something, this will give us like a starting point to say, okay, so your fear of ghosts or monsters or whatever, tell me more about that, and when does it happen, and do you think that they're real or do you think that they're pretend? So you get more information on those specifics. Clinical interview with a child and parents. There are some kids, and I'd say boys are more likely to do this than girls, is if I were to ask them what's going on, oh, it's fine, yeah, I have a problem, and they sort of minimize the problem, but then the parent comes in and they say, well, actually, he had a major meltdown yesterday when it came time to go for football practice or whatnot. So some kids underreport and maybe in a little bit of denial because most people don't want to admit that they have a problem. We have rating scales that we can use. The multidimensional anxiety scale for children is a standardized test that asks kids a series of questions about anxiety. The Beck BYI2, the Beck Youth Inventories, those also have for kids 7 and up, an inventory that looks at their responses to various questions having to do with anxiety, depression, self-esteem as well, and comparing it to kids who don't have those problems. So we say, okay, are you reporting more symptoms of anxiety compared to most kids your age? Sometimes psychological testing is helpful, including projective testing. Projective testing involves things like looking at ink blots, the Rorschach test, and we ask kids to say what they look like. The thematic apperception test, where we show kids cards and they have to make up stories. And sometimes anxious themes come through in both of those tests that you might be surprised that you may or may not have suspected. That gives us an idea as to what are the things kids might be worrying about. All right. I want to just notice a couple things here. Getting yelled at is a fear of many kids, especially if they get yelled at school. Strangers is fairly normal. Again, taking tests. These are kids with test-taking anxiety. They may know the material and they get to school and they can't reproduce it because their anxiety is so high. And remember what I said earlier about the the fight or flight response and freeze response and the amygdala and neural hijacking. If you're so anxious at a test and your thinking brain shuts off, you're not going to be able to remember all the things you need to remember for the test. The fear of heights, talking in front of people, meeting new people, blood, something bad happening, war and or terrorism, and getting sick. Obviously, some kids had a real hard time during COVID. They were just so afraid of getting sick or something bad happening to people that they care about. All right. So let me move on to parent factors that contribute to a child's anxiety issues. And a lot of times parents will do this not realizing that it's causing a problem. So that's why I bring this up. And one of the things for you guys to remember as parents is just try to be honest with yourself and see if this is something that you are doing, because these are things you have control of. So if you can change some of these factors that may be making it worse, you can go a long way towards helping your child overcome some of the anxiety issues. So being an anxious role model, if you're constantly pushing your kids to wash their hands, to not get sick, to not go outside because something bad's going to happen. I mean, this sort of, we call it helicopter parenting, let's say here. If you are conveying a sense to your child that the world is a scary place, your child is more likely to be anxious. One of the problems with just that sort of thing in general is that when anything bad happens anywhere in the world, we find out about it on TV, right? So it's newsworthy. So the problem with that is it gives the impression to parents that the world is a much more dangerous place than it really is. For example, certainly when I was growing up, you could disappear on your bike for hours and then you just had to come back for dinner. I don't know too many parents who do that now, because now it's seen as like, oh, you're not a good parent because you're just letting your kids roam. Their parents have been get accused of child abuse because they let their young children walk to the library, for example, on their own. So again, when we're overly concerned about that, it can give the impression that the world is a scary place. So now, obviously, if it's your child, you want to keep them safe, and so I understand that safety does need to come first. But keep in mind that if you are overly cautious, you may be making anxiety worse for your child. Okay, reacting critically to your child's fears. If you are, and I will say this, that dads are more guilty of this than moms, in my experience, that if you just tell kids, oh, suck it up, buck up, be a man, you don't need to be afraid about this, your child's going to tell you less about what's really going on. It just makes them feel worse. And if you remember what I said earlier, that self-esteem can be damaged. And when self-esteem is affected, that's often what triggers more depression if you're reacting critically to your child's fears. So it's really important to try to be open, accepting, and actually thank them for letting you know what's going on with them, okay? You also have to be careful that if you're reacting critically to your child's fears, try to be honest with yourself. Did you have similar issues when you were that age? And might you be trying to, I don't know, avoid that somehow, that if it's an uncomfortable reminder of those issues for yourself, that could be part of what's going on. So what's actually much more helpful to kids is to let them know, yeah, I had those problems when I was your age as well. So I understand how scary that can be. Again, being overly protective. Be careful with OCD. Think of the 5-second rule. If some food drops on the floor, after 5 seconds, you pick it up, it's okay. Maybe you have to have the 20-second rule when it comes to OCD. But the main thing is make sure that you're not making comments that exacerbate it. I'm not saying never wash your hands or, let food sit for hours before you pick it up and eat it. It's okay. But keep in mind, again, just monitor yourself and ask yourself, is what I'm saying and demonstrating to my child actually adding to the problem? Being overly punitive or authoritarian in your parenting style, that also exacerbates anxiety disorders. Because if your child, if the punishment's too heavy-handed, your kids are going to be more anxious because they're afraid of getting in trouble because they know that the consequence will be great. Being authoritarian means that your kids don't have many choices. Basically, you set the rules and they just have to follow them. They have no say whatsoever. The problem with that is that kids don't learn how to make good decisions, and making some decisions for themselves actually helps them to be more confident, and kids who are more confident are less anxious. Mental health or addictive disorders in parents. Obviously, if you are suffering from a mental health or an addictive disorder, it's really important for you to get treatment for your own disorders because it's going to make you more effective as a parent. Uh, Certainly things like, again, anxiety. If you have untreated anxiety, it's more likely you're going to pass that down to your kids just by them observing how you react to situations. Lifestyle. This also goes back to the helicopter parenting. A lot of parents they don't like the idea of their kids being on video games for hours, but what they tell themselves is that, okay, well, at least they're safe. At least I know where they are. But actually that can fuel anxiety because you're keeping them from going outside and getting good exercise, getting them exposed to some scary situations and them learning how to handle those. So it's really important if you have kids with anxiety to promote exercise, to make it a family event, to make it fun also, which makes it easier for kids, and to limit the game playing and the exposure. One of the things that you have to be careful of with regard to the really young kids is that things on TV look so real because of the computer graphics and whatnot, CGI effects. So it's really hard because they look real. As adults, we can say, oh yeah, that's really scary. And actually we still react strongly. You jump if you see something scary happening in a movie or a TV show. But imagine how much worse this is for kids. At least we know that it's not real. But little kids don't know that. I have kids who have seen commercials for scary movies, and that was enough to give them nightmares and create separation anxiety and keep them from being able to go to sleep because they're asking, what's going to happen. They may just see an image of Chucky, for example, way back when, or Jason, or Bloody Mary. There's a number of different things. Slenderman. There's always something in each kind of generation that kids are afraid of. So really try to monitor what your kids are seeing and exposed to. Sometimes you may not be exposing that to them, but they may have younger or older siblings who are watching some of the scarier stuff. All right. So what I'd like to do for the rest of the talk here is focus more on ways to help your anxious child. We'll talk about some coping strategies. We'll talk some about treatment as well. Okay. So it's really important to let kids know that help is available. Anxiety is one of the most common disorders, but it's also one of the most treatable. We have many different strategies that can work to help kids learn. And if you let the kids know, I know this is really hard for you now, but we're going to get some help from somebody who knows what, who has some expertise in this, and we'll try different things and it'll get better. And kids feel so much better when they're able to actually overcome some of their anxiety and be proud of themselves for doing it. It's really important to accept, validate, and reflect their feelings. And to let them know that, again, you understand it. If you're too quick to tell them why they shouldn't be anxious, you're basically telling them not to feel. You're invalidating their feelings, okay? So you don't want to do that. You don't want to say things like, oh, you shouldn't feel that way. Or it's better to respond if they're telling you, say, oh, that sounds really awful. I'm sorry you're so worried. Is there anything I can do to help? Or, thanks for letting me know how you're feeling. Tell me more about it. And then even just repeating back what they're telling you, basic reflective listening. And once kids know that you understand, their anxiety level actually goes down just by that. Because knowing that you understand and that you are supportive of their feelings, then they're going to be more likely to respond to you when you're giving them suggestions. So make sure that you participate in your child's treatment. If you decide to go into counseling for your child, make sure that you're part of that because you need to be part of the solution. And the therapist should be able to give you some strategies that will help your particular child because obviously each child is different. So you want to help your child express feelings appropriately, okay? That sometimes when kids are really anxious, they may respond inappropriately. Maybe it comes across as disrespectful, but that just reflects the level of stress they're feeling in the moment. Don't be too quick to say, don't talk to me that way or don't raise your voice to me because that's shutting it down. Instead, you want to help them redirect it to say, hey, I'm really glad you're telling me how you feel, but you're yelling and screaming and I can't really listen to you if you're being that loud. Can you bring it down just a little bit? And also keeping in mind that you can't expect kids to have the level of emotional control that you do as adults. And that always struck me as something that was very strange. Kids are still learning how to develop their feelings. And actually, the brain doesn't fully form until around 25. So think about that if you're working with teenagers as well. It's really difficult to stay in control, calm, cool, and collected when your brain isn't fully formed and these thoughts just come out. And I'm not saying just accept it completely and don't say anything about it, but you want to try to redirect it and tell them, hey, if you're really upset with me, for making you go to practice or whatnot, you can tell me. You just say, I know that you're really upset about this, but last time I brought you, it was really tough, at first, but then you got more used to it. So what can I do to help you with this feeling that you're having? That's a very respectful way of asking your child. Again, teaching coping strategies, but ask if they're open to some suggestions. Encourage regular exercise for reasons I've mentioned before. Provide structure and reasonable limits. So kids feel more loved, more cared for when they kind of know what to expect, okay? And they can count on you to intervene when necessary. So when you're setting reasonable limits, where you're saying, okay, no, that's not okay to go here, it is okay to go there, or you can do this if you're with somebody else, you set those reasonable limits to help keep them safe, they feel better as well. Setting reasonable limits even at home in terms of the interactions between siblings can help with anxiety. To be able to say, hey, listen, I know you guys are upset, but it's really upsetting to me when I see you guys fighting. What if you bring it down or take a 5-minute break and come back and resolve the problem? Something as simple as that can actually help with anxiety as well, because they can trust that you are going to intervene when necessary. Structure has to do with making things predictable. Kids with anxiety do better when they know what's expected. That's often why they ask a bunch of questions. So if they know what to expect going in, that is providing structure. If as much as possible, you have dinner at a certain time. Maybe there's certain times of the week where you do cleanup together as a family. Those predictable activities do help. And I know in today's world, it's really hard to do that. So I would say that's something you might aspire to, but you're certainly not going to always be able to do that. As I mentioned earlier, be able to get help for yourself if needed. That can be, again, I already mentioned why that's so important, but try not to shortchange yourself on that, because when you're more calm, when your anxiety is under better control, it's much easier for your kids to do what they need to do. It's interesting. One of the things that I do with kids that I'm working with, and especially teenagers, is I help them reinterpret their parents' actions. That if you're yelling at them for something they did for not coming home on time and whatnot, or not coming home at all, with some of the teenagers who are acting out more severely, and I say, what feeling do you think is driving your mom's behavior and what she's telling you? Okay, so it's anxiety. So do you want your mom to be more anxious, or do you want her to be less anxious? Okay, well, if you want her to be less anxious, telling her where you are and coming home when you say is really going to help her be less anxious. So that way they recognize anxiety in other people, so they don't take it as personally. That actually is a very helpful thing. Maintaining a positive attitude, again, that has to do with letting them know that things can get better and that you believe in their ability to be successful. For example, if your child comes to you and is very anxious about a situation, you can say, yeah, I know, and I'm glad you told me how anxious you are. But I also know you, and once you get used to a certain situation, it does get better. You just have to get there. So I know you can do this. I believe you can do this. Telling your child that you believe in them is really helpful. Avoid excessive reassurance. I mentioned this briefly earlier. This is especially important for OCD. If you reassure your child repeatedly that something is safe, or something's okay to eat, or something's okay to do, then they become dependent on that reassurance. And so what it actually does is it just makes it worse. It's sort of the symbol, sort of like if you give in to your kids every time they yell at you and you give in to whatever they want, you are teaching them that all they have to do is bully you and you're going to give in. So if you give excessive reassurance, it doesn't help. It just makes it worse, because you can't possibly give enough reassurance. They're going to ask another 5 questions, another 10 questions. And that's why I said to limit the number of questions they can ask. Kids don't like it, but it teaches them how to keep it under better control. Sometimes I'll have kids go into a journal. Okay, write down all the questions that you want to ask, and then pick 3 of those you can ask during the next hour where you're allowed to ask questions. And so what parents can do, and when they're asking for the reassurance, you can say, you know the answer to that, or I've already asked that before, or what do you think I'm going to say? Things where you're not repeating it, because again, you don't want to get them dependent on you having to repeat yourself all the time, because then you're going to get angry eventually, and then you're going to say something that maybe hurts your child's feelings, and that just makes it worse. Trying incentives with the child's consent. I've used this for dealing with scary situations. I've used it for separation anxiety. For example, I had one child who could earn, if he was able to stay in the room with me a certain amount of time by himself, he could earn going out to his favorite fast food restaurant. That was rewarding to him for whatever reasons. That worked. I have another child that I work with who was afraid to sleep by himself. But I suggested, well, what if you could earn some money for sleeping by yourself? And all of a sudden I got his interest. He said, well, what do you mean? Well, what if you could earn like $1 for every night that you could sleep by yourself? And he says, yeah, I think that'll work. And it worked. And the next day, the problem was solved. So we've actually weaned him off of the dollars earning, but at least that, because what incentives can do, if your child is okay with it, is it gives them an additional thing to think about. It's almost like a distraction. Like, okay, I really want this reward, but I'm afraid to go from here to there. So let me just focus on the reward. And then they feel better about themselves because they did. I say with child's consent because what you don't want to do is set up a situation where you're rewarding them and it's just too much for them and they can't succeed. And then they feel worse about themselves. So you do not want to do that. Don't overschedule. Downtime is important too. How do I put this? Adults usually when they're dealing with stress or whatnot, for adults, talking about it often helps. That's why we vent to our friends, to our spouses, to our families who maybe are therapists, things like that. Kids deal with stress often through play. So having some unstructured play time where they're playing with action figures or whatever, that actually helps kids work out some of their feelings because play to kids is like talking to adults. So having that downtime is important. It also gives them some time to just sort of focus on some other things because downtime we're playing things that they want to play. And I don't really include video game time in this. You got to be careful with that. But again, it actually gives them more of a sense of mastery over the environment. So for example, if you're playing with action figures and they're playing the part of this, the bad guys and they're defeating the good guys or the good guys against the bad guys, the kids feel a little bit more powerful. So they're identifying with that. That helps actually build their confidence because they're working out some of those issues through their play. Monitor exposure to sources of anxiety, screen time. It's really important as parents for you to monitor their screen time. Generally speaking, I recommend that screen time be earned. I don't worry so much about screen time if your kids are the kind of kids that like going out to play whenever they can. And if they do that most of the time and then there's a rainy weekend and you want to give them some extra time, that's not necessarily so bad. But for some kids, especially if they are self-medicating with screen time, if you think about it that way, they get so wrapped up in it, then it causes meltdowns when it's time to end. Or they're saying, just one more time, just one more battle, 5 more minutes, 10 more minutes. And then you set the limit and then they have a meltdown. These are kids who are basically getting addicted to screen time. And then you've got to, you do have to set some reasonable limits there. But again, monitor their exposure. It doesn't take long exposure to seeing something online to traumatize you. If you see something inappropriate, one of the things to think about is you can't unsee it. Once they see it, it's there. Okay, so when professional help is needed. So if the strategies I've talked about so far are not enough and not working and the anxiety problems continue, when the severity of symptoms, when they're so severe that they affect the ability to function, when self-esteem starts to suffer, those are some indicators that you need to seek professional help. Okay. You can ask for referrals for a child therapist. You really want somebody who specializes in working with kids. Your pediatrician is often a good source. If you're using insurance, look at your insurance company. It certainly can help to meet with pediatricians to rule out physical causes. Like I said, that's fairly rare. So not everybody insists on that. But if you're concerned like with stomach aches or whatnot, that's probably a good thing just to get checked out, because if your stomach is constantly churning, and the acid that goes in there, they may have like an acid reflux problem, for example. An acid reflux actually can make you have symptoms of asthma because your throat constricts. And again, that could be very scary. And if your kids are really afraid that something's really wrong with them, sometimes seeing a pediatrician and doing tests can help your child to say, okay, we've met with your doctor and we're not finding any physical causes. That's an indication that is most likely psychological and they need therapy. So let me talk about some treatment options. So psychotherapy is first line treatment. And that means is that as much as possible, you want to try counseling first because it's very effective for a lot of kids. It doesn't have side effects like medication does. Okay. Play therapy is one form of psychotherapy. As I mentioned earlier, that play therapists believe that kids can resolve some of their problems through play. The problem with play therapy is that it's something that takes a long time. It's not something that a few sessions will help. Parents often complain to me that they don't get enough feedback from the therapist because you don't know what to do. I hear that a lot actually, because there are some therapists, I'm not one of them, but there are a lot of therapists who only see the child and they may talk with you periodically, but it's considered your child's sessions. I think what works best is for you to be part of the session. So I usually include parents in some of each session because I want them to know what we talked about. Usually I have the child tell you, this is what we worked on. These are the strategies so that you know what we're doing so you can do some of this at home. Psychodynamic therapy, that has to do with, again, examining some of the underlying symptoms or motivations, unconscious factors that may be going on so that they can learn how to deal with that. That's probably not the most common therapy these days. Cognitive behavioral therapy is really the most commonly used therapy. And that cognitive has to do with your thoughts, behaviors has to do with your behaviors, of course. So for example, the ABC model, and this is one of the things that we will teach kids, that you can have activating events, such as seeing a dog. You may have, C is the result of the activating event, which is your anxiety feelings, your nervousness, meltdown, whatever. B in the middle is your beliefs or thoughts about about the activating event. And so what we do is we try to change the thoughts. If we can change the thoughts about it, it makes it better. Exposure and ERP is exposure and response prevention. And what that means is that this is used very commonly. It's one of the most effective treatments for OCD. So let's say you have a thing that you're afraid of. Say you've got germs on your hands. So you get exposed to the germs, but then you have to prevent yourself from responding. So maybe like 5 minutes before you allow yourself to wash your hands. That can feel like an eternity for someone with OCD, but you can help them tolerate it. Because the idea is if you would tolerate the exposure and you are prevented from responding in a certain way, then the symptoms get better. We're doing fine on time. Give you a quick example from long ago. I had worked with a girl and she was maybe 6 or 7 at the time, and she was deathly afraid of insects. And one year we had an ant infestation in the office. So we're sitting playing at the table and some ants come in. And I first thought, okay, this is gonna be awful. She's gonna go screaming outside the room. But no, she got scared. But what it did is I modeled, modeling is also something good. I modeled brave behavior, if you will. So when she started getting scared, I said, oh, wow, look, wow, there's some ants coming in here. I wonder what they're coming in here for. Hey, ants, let's take a look. And so I looked at the ants and we took a look, and I let them crawl on me for a little bit. That doesn't bother me at all, fortunately. And so that allowed her to come closer and closer and take a look at them. So she wasn't able to quite touch them at that point, but that's desensitization. Her normal response would have been to run, scream, and yell. But by being exposed to the scary stimulus there, she was able to keep herself from reacting that way. So that can be very effective for some kids. Family systems approach. Again, if there's some family conflict going in and we think that the child may be, like we call it, identified patients. So this is the person showing up with a problem, but the actual problem reflects other stresses in the family. So by working with the family together, we can address some of those things. For example, if we have a mother who is overprotective and a father who's critical of the mother, and then the child acts out, one of the things we can do is help the mom sort of step back and help her learn to deal with her own anxiety. That way, we don't have the conflict here between the parents, and we don't have the child acting out. So when you change that dynamic, it can help some kids get better. So it's really important to be mindful of that if that's going on. Because if there's conflict in the family, an anxious child is going to get worse. Gestalt therapy. That's not something you're going to hear much about, but I'm going to share with you one technique from Gestalt therapy. Gestalt therapy basically kind of takes it takes a look at the whole person. That's kind of what Gestalt means, and you look at different parts of yourself as well, and you can help the different parts of yourself talk to each other. That's one of the strategies. But let me give you a concrete example. So one of the things I will do with kids is I will have we call it the 2-chair technique. Okay, so one chair, when you're sitting in one chair, you're being your anxious self, and when you're sitting in the other chair, you're being your confident self. And I will model this for a child first. Okay, this is the first day of school. I'm going to go in my anxious chair first. Oh my gosh, it's the first day of school. What's going to happen? I'm going to get, it's so scary. I'm not going to be able to handle it. And kids are going to tease me. Nobody's going to like me. And I say all these different anxiety provoking thoughts. And then I switch chairs to the confident self. And I'll say, relax. You were able to handle this last year. Yeah, it's going to be a little bit tough, but you're a pretty nice guy, and people like you, so you're going to be fine. And then you go back to the anxious chair. But what if this happens? Well, what if I don't do well? What if I fail my first test? And then I go back to the confident chair. When have you failed a test? You never fail tests. You always study for them. So you don't need to worry about that. And that actually is kind of fun for the child to see. And then you let the child act out both parts. And what that does is sort of helps externalize because we all actually have parts of ourselves if you think about it. So that sort of helps kids learn how to have an internal dialogue. And that is one of the things that can really help them in terms of overcoming their anxiety. Neurofeedback is a strategy or technique where you basically, you get hooked up to electrodes. It doesn't give you a shock or anything like that. But what it does is that there's certain brain waves that your brain produces when you're trying to fall asleep, when you're anxious, when you're stressed or whatever. So you can teach kids how to make their brain produce the brain waves that they should be producing when they're trying to calm down. So once you learn how to do that, what it is you get connected to a screen. This is an oversimplification, but the only way that the screen is going to show you the movie on it is for you to produce the correct brain waves. And some people do report that can be helpful. Problem with neurofeedback is it takes multiple sessions, usually in a week. It can take multiple weeks. The idea, though, is that maybe you can make some permanent changes in the brain so that you wouldn't have to resort to like medication, for example. Hospitalization or day treatment for kids who are so out of control that they cannot function in the home environment. Sometimes hospitalization helps if they're having any kind of suicidal thoughts as a result of their anxiety, because that way they get treatment faster. And if medicine is indicated, they can prescribe and monitor it right there before they kind of send them back. So this is not frequently done for anxiety alone, but it can be an option. Okay, let me talk a little bit about psychiatric medication. I know people have a lot of questions about this, and there's stuff out there that, I think that we're, I don't know, drugging kids or whatever. So psychiatric medication is helpful when counseling alone doesn't help. Again, we usually try to do counseling first, but if it's not helping and the functioning is significantly impaired, then we'll make a referral to a psychiatrist to look at psychiatric medication. SSRIs, which is a type of psychiatric medication, it's an antidepressant. Selective serotonin reuptake inhibitors is what that stands for. I'm not going to go too much into the pharmacology as to how that works, other than to say it makes serotonin work harder in your brain. These are some of the very commonly prescribed medications. Prozac is the brand name, fluoxetine is the generic name. Same here with Zoloft, Paxil, Lexapro. Others, Cymbalta and Luvox. Luvox is often prescribed for OCD. So, and medication is usually needed for severe OCD. That therapy alone doesn't tend to be as helpful because with OCD are so impaired in their functioning and is so difficult on the family. Are we drugging kids? You're always going to have people who think we're too quick to resort to medication. And, there may be some truth to that sometimes. But it's not like there's a conspiracy to drug kids. We prescribe these medications because we see how helpful they can be. When you see a kid going from being so scared they can't even go to school to, say, trying out for a school play or being able to go out for a sports team or whatnot, they feel so much better about themselves. And I would not want to deprive them of that experience, because if you wait too long, the damage that's done in terms of their self-esteem, their tendency to self-medicate when they get to be teenagers is very high. And so when they're on medication that helps, the risk of resorting to those sorts of things is lower. Off-label use. There are medicines that are approved by the FDA for particular population, whether it's adults or children, say over the age of 6. Psychiatrists often use medications off-label, which means it may not be approved for use in this particular population. And that's simply what it often means is that the studies haven't been done. But if a psychiatrist believes that that medication might work for this particular child and has had good experience before, they can use it off-label. Risks of medication and risks of not trying medication. That's another thing for you to think about when you're making these decisions. There are risks of medication, okay? There are potential side effects. Some medications can make you too tired, for example. Some will make you too activated and too stimulating. Some may make you hungry, so you want to eat too much. Some may take away your appetite. So there are side effects like that. But there are also risks of not trying medication. And I think you need to kind of balance those, because the risk of not trying medication when it's indicated is that the degree of psychological damage that is being done over a period of time by your child not being able to function and not feeling good about themselves. Always ask about potential side effects or risks. Psychiatrists who knows what they're doing should have no trouble telling you these are the risks you need to be careful of. These are the things that you watch. One of the reasons of having a pediatrician, check things out first is often we get like blood levels of all their different, different components of the blood, your red blood cells, white blood cells, etc. And if you get a baseline there, then you try medication. And if you find problems later, you can say, okay, maybe that was likely caused by the medication, because this was the case before medicine and this is the case after. It's important to monitor closely. Make sure that your child is taking it properly. Some parents leave it completely up to the child to take medication. Kids are notorious for not wanting to take it. So, and also you don't want to have them take too much. So make sure that you monitor closely so that you know they're taking it. Let me talk about one other thing here. Let me move back here, risks of medication. One of the concerns about using antidepressants in kids is that for some people, it triggers suicidal thoughts. And so what happened is when that research came out, people stopped prescribing antidepressant medication for kids. And guess what happened? The incidence of anxiety and depression got much worse. So, and the reason was nobody wanted to prescribe these medications. So further research shows that yes, in some small percentage of people, they may have some suicidal thoughts that were not there before. That's why we always have to ask about that. And I will tell kids, hey, if these thoughts start coming up and you start feeling really agitated, let us know right away. We'll take you off the medicine. It's the medicine. So, and even in the studies, there weren't actual completed suicides. It was just more of a increase of thoughts. So, but if you have questions about that, you can find some of the research out there. You certainly can ask a psychiatrist about it. So also look at the availability of the prescriber if there's questions or emergencies that come up. I think it's really important if you're going to prescribe medication, you need to be available, because if there's a side effect or something you're not sure of, you should be able to call that person and say, this is what we're seeing, what do we do? Both of our psychiatrists, for example, are available. We all have, we have an answering service. So if an emergency comes up, you can reach them. This research, or this resource, American Academy of Child Analysis and Psychiatry Medication Guide, you can download this from the internet. I put the link right here. It gives a lot of good information about what medicine's used for, some of the side effects, some of the things to look at. So I think it's really important to educate yourself about medication. That way you'll also know some questions to ask. All right, so I hope that the presentation has been helpful to you, that you have a better understanding of kind of what causes anxiety, what it looks like in kids, things that you can do that either make it better or worse, and a number of treatment strategies that you can use with your child. My book, What to Do When You're Scared and Worried, you can get that on Amazon. It's published by Free Spirit Publishing. As I mentioned earlier, I believe that if kids learn about the disorder that they have, they go a long way towards being able to treat it. And I've had kids come in who've actually read the book and they say, Dr. Chris, I read this book and I think I have generalized anxiety. I says, oh, well, tell me more about it. And they read and they can give me examples. You might be afraid you don't want to give kids ideas, but the idea that's pretty rare. Kids don't come in, most kids don't want to be ill or have a disorder. But if they can recognize themselves in it, they get hopeful. Wow, okay, this really describes me. What do we do about it? And I say, oh, well, I think you're right. I see these things as well from what you're telling me. These are some strategies we can use to help you overcome it. So this is my contact information. If you want to reach out, Child and Family Counseling Center has a website, cfcc.info. If you go to that website, you'll find a lot of useful information. There's resources on parenting, on mental health issues, on academic issues, on addiction issues, support groups, etc. So please feel free to check out our website. I have my own website that gives you links to the different books that I've written. It also gives you links to some of the presentations that I've given, so you can listen to them as podcasts. So I think that's it.